Neurology quiz number 11. Which headache disorders are indomethacin responsive? These are paroxysmal hemicrania, a trigeminal autonomic cephalgia. This is characterized by severe unilateral, retroorbital and temporal pain, lasting 5 to 30 minutes with ipsilateral autonomic features like conjunctival congestion, lacrimation and rhinorrhea, and 5 or more attacks per day. Circadian pattern is rare. Hemicrania continua, also a trigeminal autonomic cephalgia. This is characterized by a persistent baseline unilateral frontal or temporal pain with intermittent exacerbations which are accompanied by ipsilateral autonomic features. Primary cough headache, a headache that is brought on by coughing, straining or other Valsalva maneuver. Primary headache associated with sexual activity, a headache that is brought on by and only occurs during sexual activity. Primary exercise headache which is brought on by sustained strenuous physical activity. Primary stabbing headache or ice pick headache characterized by ultra-short 1 to 2 second unilateral stabs or jabs of pain, most commonly in the ophthalmic division of cranial nerve 5 without autonomic symptoms. What are the non-dystrophic myotonias? They are muscle channelopathies characterized by muscle stiffness and impaired relaxation without significant fixed weakness or muscle atrophy. Myotonia congenita is due to mutations in the chloride channel gene on chromosome 7, autosomal dominant or Thomson type, and autosomal recessive or Becker types occur. The latter is most severe with earlier onset. Onset is in the second decade with muscle stiffness, pain and fatigue. Patients often have hypertrophic muscles and the myotonia typically improves with activity. It is commoner in men. Paramyotonia congenita is due to mutations in the voltage-dependent sodium channel gene on chromosome 17. The myotonia worsens with activity and hence the name paradoxical myotonia or paramyotonia, and also worsens in cold weather. A variant, potassium-aggravated myotonia, can be precipitated by potassium-rich foods. EMG reveals waxing and waning discharges with a characteristic dive bomb sound. Diagnosis is confirmed by gene testing. Mexiletine, a cardiac antiarrhythmic, is considered the drug of choice for treating myotonia. What are the Tauopathies? Tau is a microtubule-associated protein which stabilizes microtubules of neuronal axons. In disease states, it undergoes changes including phosphorylation, truncation, and aggregation. Diseases considered primary tauopathies have in common abnormal deposition of aggregated tau in the brain. These include progressive supranuclear palsy, corticobasal degeneration, frontotemporal dementia, and chronic traumatic encephalopathy. Some authors include Alzheimer's disease in this group, while others exclude it due to the prominent role that beta amyloid plays in the pathogenesis. Misfolded protein aggregates, as seen in the tauopathies, can self-propagate through seeding and spread pathological abnormalities between neuronal cells in a manner akin to infectious prions in the prion diseases.